So measles is a viral infection that can usually present in a number of ways, but typically we talk about the 3 C's, so cough, coryza, which is runny nose, conjunctivitis or redness of the eyes, fever, and then a rash. The typical rash progression usually starts at the head and works its way down, but that doesn't happen in all cases. Kids can feel quite miserable, like with many other viral infections, but there are some serious complications that can develop as well, including inflammation or swelling in the brain that can leave someone with lasting neurologic or brain damage. It can cause inflammation or swelling in the heart or lungs as well. And so all of these can cause very serious, complicated infections and even lead to death. The biggest myth out there is this link between measles vaccine and autism. This is something that many parents raise to us as their reason for not wanting to vaccinate their children against measles, mumps, and rubella. This is something that comes from a now discredited, retracted study from the late 1990s that came out in The Lancet, has since been retracted from that publication, and all of the co-authors have kind of removed their names from being associated with that paper. But unfortunately, it's kind of really worked its way into the minds of people and has raised this question as to whether there is any link between the MMR vaccine and autism. This has been studied now time and time again, including a large study that came out last week, the largest study done in Denmark, over 600,000 children studied through a population-based registry that again has shown that there is absolutely no link between MMR vaccine and autism. In that study, they also looked at a subgroup of kids who were determined to be at a higher risk of autism, either through risk factors such as having father or mother with advanced age, sibling with autism, and even within that group at increased risk, they did not find any association with MMR vaccine. This is not the first study to show that. We've had multiple other studies. This was the biggest one and has really given us more data to show that there's absolutely no link there.